we have been talking this evening thus far almost entirely about the financial side of healthcare.
Right.
The other side of healthcare is the way in which the care itself is provided.
Right.
And the way in which care is provided determines not only the quality of that care, but it also determines the cost. And this is a crucial issue in interpreting the different healthcare plans of political candidates, because all of them recognize that cost is a major issue. And all of them say they're going to control costs, but none of them explain cleanly and clearly how they will control costs. And the reason why they can't do that is that in order to control costs, the way in which we practice medicine has to change, not for acute diseases, but for chronic diseases.
Right.
And we've talked in the past about the fact over the last 50 years, the prevalence of chronic disease has risen to the point where it's a major cause of disability, the major reason why people visit physicians, and care of chronic disease is responsible for 80% of our healthcare expenditures. Now, the issue is how effective is the care those patients get for that 80% of our expenditures. And there's substantial evidence that at least 30, perhaps as much as 40% of that expenditure is waste.
That is an amazing fact.
Now, these issues don't come up in any of the
That's
politicians' discussions about their favorite health plan proposal.
So what we're really saying, if we're trying to get any point over to people getting hit by this, overwhelmed by this information about healthcare plans, is they're going to hear about insurance policies. And they're not going to hear about provision of health care. And yet, the two have to be considered for any kind of solution to the health care crisis.
Well, that's largely true. Now, you can establish mechanisms whereby, with some sort of authority, and as far as I can see, that authority would be almost exclusively government, perhaps in conjunction with professional societies, some sort of authority over the way care is provided. That can happen, but it hasn't yet, and it's not a part of any of the proposals. So what we're really confronted with at the present moment is decisions about financing, not decisions about the type of care that we will get for that financing. And until both sides of this healthcare crisis are addressed, we're not going to have a solution to the crisis.
So you mean, for example, the one of the proposals is not only to replace the private insurance companies and do single payer insurance. Single payer insurance is just a fancy term for government insurance. And as an economist, I can tell you the economies of government handling the insurance policy is overwhelming.
Well, you have to explain why.
Oh, because of the risk pool. Mm-hmm. The government expands, maximizes the risk pool. And in everyday terms, one of the things that means young people take care of old people.
Well, yes, my understanding of the risk pool is that it has to do with the number of people who are insured. The larger the number,
right, it would automatically, that's right.
The better the cost. And when you have a fragmented healthcare system with many different competing private insurance companies, almost all of them being profit-seeking companies, then you have the risk pool of the population of the country cut into sections that can never operate with the economic efficiency of an insurance plan that covers the entire population, young people and old people. And that's what you were driving at.
Yes.
With the young people being in the plans so that the costs of covering the older people
now this
are
and this is a point that is very seldom referred to For example, taking Schwarzenegger's plan, which is of this second category, maintaining the private insurance companies. And once you do that, he tries to set up a big pool and say, we'll get the economies that way, and he fails. It doesn't work. It doesn't do anything like the government stepping in, and the prime example of single payer is Medicare for people 65 and older.
Right.
And they provide, there are very few people over 65 that complain and say that Medicare is not a good system. And so one of the things that's taking place in the single payer thing is in essence to say, let's take Medicare back over all age groups. Then we're into this business about the pool and getting the efficiency and paying for something.
Right, but we have to remember that Medicare is an insurance plan.
Right, right.
It is not a care provision.
Well, they're certainly trying to do something.
Well, one of the reasons why yes, that's correct. Medicare is trying to influence the way care is practiced, at least for certain segments of the elderly population. But the crucial point is that the financial difficulties that are mounting for Medicare are just as much a product of the absence of a good care provision portion as it would be the case with private insurance companies.
I don't know whether people really know about this, but Medicare is at the center of the Congressional Budget Office's projections saying that the costs of Medicare will be so high that it'll break the bank.
Right.
And the reason for this is provision of health care, not insurance.
Well, think for a minute. Who are the people who have chronic disease? Overwhelmingly, they're the elderly. So unfortunately, Medicare is confronted with a segment of the population that is most likely to have the illnesses that the provision of care deals with so poorly. So that however we do it, whether we do it with some modification of Massachusetts or the Schwarzenegger plan, with government regulation of insurance, or do it through a single universal healthcare plan, insurance plan run by the government, we're going to have to address the question of how we practice healthcare.